Goldstein won the Nobel Prize for LDL receptor characterization. Statins were a great discovery for cardiovascular risk reduction. Ezetimibe is very useful in the therapeutic armamentarium. But what came next? What was the next cholesterol revolution? A small percentage of individuals were found who had naturally low levels of LDL without any medications. Certain mutations in people conferred significant risk reduction over their lifetime. This finding eventually led to the development of the PCSK9 inhibitors. PCSK9 inhibitors, or proprotein convertase subtilism kexin type 9 inhibitors, are a newer class of medications to lower cholesterol. They make use of monoclonal antibody technology and represent a major advancement in hyperlipidemia medication repertoire. They are very potent at meeting thresholds, causing significant lowering of cholesterol levels. The PCSK9 inhibitors cannot be consumed orally in solid or liquid form, hence are given as a subcutaneous injection. An advantage is that rather than being consumed daily, they are taken every fortnight. Studies have shown that even longer intervals of injection may be sufficient. They are self-injectable by using a specific pen, not coming to hospital or visiting your GP every time. The current main PCSK9 inhibitors are Praluent, alirocumab, which may come in two doses, the 150 mg and 75 mg, and Repatha, evolucumab, with a 140 mg dose. One of the notable clinical trials conducted was the Fourier trial, a cardiovascular outcomes trial on the PCSK9 inhibitor evolucumab. PCSK9 inhibitors are well tolerated overall and very effective. I have seen cholesterol really plummet on these medications. Side effects may include injection site reactions. Neurocognitive concerns have been reported in a very small percentage of individuals. Also, given they are relatively recent medications, longer-term side effects profiles are yet to be established. They are currently very expensive. Remember, although some cholesterol is needed for normal biological function, too much is bad. There is compelling data on cardiovascular risk reduction with LDL lowering. Risk reduction rates per millimole reduction in LDL have been reported, namely less heart attacks, less strokes, better outcomes. PCSK9 inhibitors are useful in inherited conditions such as familial hypercholesterolemia (FH) and intolerance to statins. Maximal statin dose and those with pre-existing cardiovascular conditions on maximum lipid-lowering medications and require further LDL lowering than what presently achieved. Patients would have tried the statins first and had side effects, or the LDL lipid lowering was not sufficient on the statin alone. Now, the LDL cholesterol drops with PCSK9 inhibitors are remarkable, and these are effective even when used in conjunction with the statin. The PCSK9 inhibitors show yet again another story from experimentation to accumulation of evidence to subsequent clinical reality.